Hello everybody, and welcome today to a webinar on Healthcare Science Innovation Fellowship. My name is Vicky Chalker, I'm the Deputy Chief Scientific Officer at NHS England, and it's a real pleasure to join you today to discuss this. Can we have the next slide, please? So I'm just going to do a few introductions for the people we have on the call. We have Bassett Abdul, he's a Healthcare Science Fellow at NHS England, Louise Kitley, the Portfolio Manager at NHS England, Professor Wendy Tyndale, who is from Devices for Dignity, where she's a Clinical Director, Dr. Avril McCarthy, a Lead Clinical Scientist in Devices for Dignity MedTech Lead, Dr. Claire Bartlett, Dr. Anisha Soni, Dr. Sarah Bant, Dr. Darren Hart, Dr. James Osborne, and actually Darren and James are prior fellows as well. Mark Unstead, I think, is also joining us from the Royal Berkshire NHS Foundation Trust, and Laura Brown is also on the call. We're really pleased to have you today, and it's my pleasure to hand over first, I think, to Louise Kitley, who's going to tell you a little bit about the programme and further details, but I will first of all just explain to you that this fellowship is very exciting. It's done in collaboration with a number of different organisations working together: NHS England, Health Science Cymru or Wales, the National School for Healthcare Science, NIHR Devices for Dignity, the MedTech Co-operative, the Academy for Healthcare Science, and also Health Education and Improvement in Wales. So over to you, Louise.
Thank you, Vicky. It's really nice to see everybody today. And as Vicky says, there's a lot of people involved in this collaboration and organisations, but it actually was developed over 3 years ago now. And I guess initially from conversations through the National School of Healthcare Science, the Chief Scientific Officer's Office, and Devices for Dignity. So that was the sort of ideas behind this. And the purpose of it there was about training clinical scientists how to develop and adopt, at that stage, innovative technologies and to initiate and lead their own programmes and projects around innovation. So this will be the third cohort of fellows that have been funded by NHS England and HEI Wales. And just to note that actually HEE and NHS England merged this year in April. So that's why you won't then see Health Education England as a separate organisation anymore. But the people are still here and we've merged. So we're still providing that support and financial support. As I said, the fellowships really are a driver for innovation, and I just think in the short time I've been working with healthcare scientists, knowing how innovative bunch of people they are, this really presents an opportunity for healthcare scientists to really thrive in that innovation environment. And importantly, provides that opportunity for scientists to deliver on this while being supported outside of their day-to-day job, rather than trying to squish something into a day-to-day job as well. So a real opportunity. In the previous cohorts, we've always tried to have a theme each year that's particularly topical for that year. So as you can see on the slide, previous cohorts we've had cancer. That was the first one. Last year we had digital technologies, and then for this year's theme, really topical and wide-ranging, is reducing healthcare inequalities. So we will be looking for people to work on innovation and projects within healthcare science to address healthcare inequalities. So I just wanted to give you, you're going to hear from some fantastic fellows that have lived and breathed this experience, but actually we did an evaluation with Devices for Dignity after the first cohort. And what that really highlighted was the impact that the fellowship work had, both for the fellows themselves, who saw really notable benefits around integration of that day-to-day clinical role with the opportunity for conducting research. So really bringing that together, and that's what we want to do, and to achieve some really great outcomes. So, I think we've already got evidence that this fellowship really works and is a fantastic opportunity. And I think rather than give you any more detail about it, which others are going to do, I'll leave that there. But I'd like to hand over to Sarah. As I've said, this is a real collaboration with Health Education Improvement Wales as well. So Sarah can talk a little bit more about that for some differences. So thank you very much, and over to you, Sarah.
Thank you, Louise. So from an NHS Wales point of view, I just wanted to confirm that this is really important fellowship actually to the healthcare science professions. We've got a healthcare science strategic framework that recognises the value that healthcare scientists bring to innovation, not just within healthcare science, but actually across the NHS, and the need for our scientists to access opportunities like this. We've got a lot of training and education and development available for research, but less so for innovation, and that was recognised a few years ago, and the reason why this was set up. And it also supports the Welsh Government Minister for Health and Social Care's new diagnostics recovery and transformation strategy, and our Welsh Government policy to move towards a healthier Wales. So again, you know, we need the opportunities for our scientists, but actually, yes, it's about your career, your progression, you know, your development, but it's about the wider NHS as well, very much so. So we've been supporting the programme since cohort 2. For those candidates that are successful from Wales, we provide the funding for the programme delivery, but also for the bursary that you receive, and we work really directly with you on that and interact with you directly and with your health board or your trust in NHS Wales. In terms of who's eligible from Wales, we've just got a slightly different approach in that underneath healthcare science policy in Wales, we also include radiographers and operating department practitioners. And so if you are a radiographer or an ODP that's working in the NHS in Wales, you're also eligible to apply for this fellowship too. So that's all that I wanted to say today. Really looking forward to hearing from our fellows in the rest of the session. And I'm just going to pass you over next to Professor Wendy Tyndale in terms of just giving an overview of the fellowship programme. Thank you, Wendy.
Thanks, Sarah, and hello, everybody. We're delighted to be launching this third cohort of the Healthcare Science Innovation Fellowships, which has been made possible through the collaborations that you've just heard about. And as Louise has said, the fellowships are aimed at developing the innovation skills of healthcare scientists and equipping them with the tools, the knowledge, the experience to become future leaders in this area. So I just wanted to say a word or two about what Devices for Dignity is by way of background and why we're delivering the programme. So essentially, we are an innovation organisation. We're funded by the National Institute for Health Research, and we're based within the NHS. And our remit really is to deliver new medical technologies in response to unmet needs. So we're hosted at Sheffield Teaching Hospitals, but we very much operate nationally. So we work across the NHS, across academia, and with industry, and we work directly with patients and members of the public. We've actually been operating since 2008, so we've got a lot of experience around innovation pathways and the challenges and how to deliver success in those areas. So these innovation fellowships enable healthcare scientists to work with Devices for Dignity and our various partners, and to embed themselves in an innovation journey which lasts for 12 months. The programme itself is a blended approach of project-based delivery, there's online learning, training resources and mentoring as well to undertake a technology innovation project which will be of benefit to both the fellow themselves and also to their own department. And the fellows will develop a whole variety of different skills, including things like project management, inclusive design methods, patient and public involvement and engagement, ethics and regulatory aspects of getting novel technologies into service. And they'll also get involved in things like understanding the routes to market for new technologies. What goes into things like adoption in the real world, and also redesigning or optimising clinical pathways. So the programme itself is open to all qualified healthcare scientists in the NHS in England and Wales who've got at least 1 year post-qualification experience. and applicants commit on average a day a week to the programme with the support of their host department. And the host department gets a £15,000 bursary, which can be used to support the fellow in their innovation activity over that 12-month period. So as you've heard, in the first year, we had a broad focus on technologies to help people living with and beyond cancer. In the second year then, we changed that focus slightly. We had a new focus on digital technologies in the broadest sense. And now for this third cohort, we've got to focus on technologies which are relevant to issues around healthcare inequalities and how they can support diagnosis, monitoring or management of people living with long-term conditions. So you'll hear a bit more about the benefits of the programme from our fellows, but just the main benefits really of the programme being you'll obviously gain innovation leadership skills, you'll gain knowledge about the tools, techniques and partnership approaches which can often make the difference between success and failure of an innovation project. It'll give you access to new networks, new partners, hands-on experience of a technology development project, and also prepare you in the future to best support your own organisation more broadly with innovation to address unmet needs. So just finally to say, this genuinely is a really exciting programme. We've loved having the Innovation Fellows so far, and I think everyone has learnt a lot. And actually, we can't wait to have our third cohort joining us. So with that in mind, I'm going to hand over now to Dr. Avril McCarthy. Avril is a healthcare scientist, and she's been very closely involved in the delivery of the programme. So over to you, Avril.
Thank you, Wendy. So I'm actually just going to talk through where the Healthcare Science Innovation Fellowship sort of fits within the sort of framework of various other programmes. So you might be wondering, why should I apply for this one versus some of the others that might on the face of it appear similar? So one key thing to point out, as already has happened, is that this is actually open, certainly within England, for healthcare scientists only, as you will have also heard from Sarah, slightly different for Wales, slightly broader. Whereas the things like the Topol Digital Fellowship and the NHS Clinical Entrepreneur Programme that you will also hear about are open to all people within the NHS. So this is very much a tailored opportunity for healthcare scientists and radiographers within Wales to apply to a programme specifically designed for you. So there are two that are aimed at healthcare scientists. There is also the Healthcare Science Knowledge Transfer Partnership Programme. That is rather distinct in that it's specifically aimed at senior collaboration and particularly with a focus on measurement and actually making transformative differences through measurement techniques. So depending who you are in terms of the audience, that may be more appropriate for you. But what we actually feel, and you will hear from our fellows directly, is that as a sort of discipline, healthcare scientists can sometimes not necessarily be as proactive or as confident in their expertise. And this serves as a really useful programme for over 12 months to build confidence and can actually act as a really effective feeder mechanism into some of the other programmes. I should hasten to add that it is a standalone programme. You're not expected to then go on, but it is a natural step to then move ahead. So Wendy's already said that it does require you to have already 12 months post-qualification experience. And the reason we've used the phrase qualified as opposed to HCPC registered is, of course, there's lots of different disciplines, and we want to make sure that we are open to as many of those healthcare science disciplines as possible. You've heard already from Wendy in terms of the role of NIHR Devices for Dignity, which is currently a MIC and will be one of the new health tech research centres from April, which we're delighted about. So we have an innovation pathway, and what you will gain is a real appreciation of the journey through that innovation pathway, from taking current practice, identifying unmet needs within current practice, validating them, designing projects, understanding how one goes about developing new medtech products such as medical devices, digital apps, etc., evaluating them, and then working to adoption and scale up. And ultimately, we're trying to promote impact through that clinically valuable technology. Now, you'll certainly appreciate that through the online learning and mentoring that we'll be delivering. We certainly don't expect that somebody's project will cover all of those aspects. Indeed, although Devices for Dignity has got examples where we've started with an unmet need and then we're delighted that we've ended up with a product on the market that's making a difference, that takes many years. And as you'll only have around about 8 months working specifically on the project, we will expect you to be sort of focusing on various stages of that process, not covering your project throughout the whole of it. And I'm now going to move on to introduce Dr. Anusha Soni, who's actually going to talk about the specific area of focus for this year's cohort. Thank you.
Thank you very much, and thank you for having me here today. It's a real pleasure to see that this year's theme is based on the really important pivotal area of healthcare inequalities. And I'd like to speak a little bit more about NHS England's approach to healthcare inequalities through the Core 20+5, which the audience may or may not have heard of before. The Core 20+5, as I say, is a national approach to support NHS integrated care systems, that's ICSs, to reduce healthcare inequalities and really to deliver on those long-term plan commitments to reducing healthcare inequalities in England, as well as the overall government ambition of adding 5 years to the healthy life expectancy by 2035. This approach is really about creating focus and a way to prioritise NHS resources and time and energy. And this, of course, is alongside a much wider system effort that includes from local authorities to the voluntary care sector. Just to explain the Core 20+5 in a bit more detail. So the Core 20 are, of course, the 20% most deprived people in the national population, as identified by the National Index of Multiple Deprivation, that's IMD. And then you have the plus in blue, which stands for population groups that's really determined by systems locally that are experiencing poorer than average health access or experience or outcomes, but those may not necessarily be captured by the Core 20 alone. So your plus groups may include inclusion health groups like coastal communities or people facing multimorbidity, protected characteristics, for example. You then have at the end the number 5, and the 5 are the 5 clinical areas of focus that we're really seeking accelerated improvement. So those are hypertension case finding and optimizing lipid management, increasing earlier cancer diagnosis, driving up vaccine uptake in those with chronic obstructive pulmonary disease, and ensuring continuity of maternity care in women from Black, Asian, minority ethnic communities, or those most deprived groups. And finally, ensuring annual health checks are being undertaken in those that are living with severe mental illness. These 5 areas were specifically prioritised after examining a huge amount of public health data, as well as critical evidence pieces such as the Global Burden of Disease study, and really understanding that these 5 areas can have substantial improvement for those experiencing healthcare inequalities. Next slide, please. And we have, of course, have a core 20+5 approach to reducing healthcare inequalities for children and young people. And you can see there the 5 clinical areas of focus for children and young people are asthma, diabetes, epilepsy, oral health, and mental health. Next slide, please. There are multiple vehicles for achieving this ambition and core 20+5 approach. And one of those vehicles, I'd say, is innovation. So, adopting innovation and technologies has a power to really positively transform healthcare from, increasing efficiencies and speed, reducing workload, all the way to improving accessibility. But without an equitable approach, there is a risk that you can actually widen healthcare inequalities. And there are many projects that are going on up and down the country that are improving access through innovative technologies and medicines with local communities. An example of this is the Innovation for Healthcare Inequalities programme, which I lead on. INHIP for short, I would like to share this briefly. It really aims to address local healthcare inequalities by those that are living in deprivation or other underserved populations. And you can see there we've got around 40 projects that are running across the country, across 4 of the 5 clinical areas. The programme is about supporting ICSs to generate evidence in piloting new approaches to spread and adopt approved innovations to underserved and deprived communities. So whilst these innovations are commercially mature and NICE endorsed, and so at a different stage in the innovation pipeline to necessarily those that will be seen on this fellowship, I share this programme because of the synergies and the aims of this INHIP programme and this year's fellowship, and that theme of tackling healthcare inequalities and the real crucial role that innovation has for that. And you can check out further information on our NHS England webpage. This is just a couple of the technologies and innovations that we're supporting adoption. Thank you very much.
Hi, so I'm Claire Bartlett. I'm going to be coordinating the programme for this year, and I just want to tell you a little bit about the fellows that have been taken part so far. So from cohort 1, we had 4 fellows from England. 2 of these will present today, and then from cohort 2, we had 5 fellows from both England and Wales, and we've got 2 presentations today as well. So I'm just going to pass on to the fellows now to tell you a little bit about their experience and their projects as well. So Darren.
So hello, my name is Darren. I am a clinical scientist and an engineer. My fellowship project started around the idea of, imagine that unfortunately you're unwell and unable to go outside. If you could choose to be anywhere as part of your care, where would that be? If you picture that place, it might be a beautiful beach, it might be a kitchen disco with your friends and family, but whatever you're picturing, it will be kind of unique and personal to you. So my fellowship project aimed to enable patients to virtually visit that place, wherever it may be, through immersive technology. So working closely with our local hospice, we used 360-degree cameras, so cameras that record everything in all directions, and we recorded a number of outdoor scenes. We also developed a system where the family and friends of patients receiving end-of-life care could borrow one of these cameras to record an environment or activity that was meaningful for that person. So the view from their garden, perhaps. Videos can be uploaded to the cloud and viewed through our customized app, be it on a VR headset so you can look around, but also importantly on a patient's phone or tablet, so potentially in the community. So this work is still ongoing. We were really delighted to gain additional further funding from Hospice UK. It's been a very fulfilling and enjoyable project to be involved with, and I've met so many great people through it. We've gained further external funding for other related projects, and also established collaborations with a number of NHS groups, academic departments, and commercial partners. So for me, this has been a highlight of my working week in recent years, and I'm really thankful to the fellowship for that. If it wasn't for the fellowship, I don't think I would have necessarily applied to the NHS Clinical Entrepreneurs Programme, which is also an absolutely fantastic programme that inspires, encourages you to think differently, and introduces you to this amazing network of people that are kind of doing great things that will no doubt shape healthcare for us and future generations. So to sum up, this is such a good opportunity. We are really fortunate as healthcare scientists to have this available to us. Whilst the protected time and funding is brilliant for developing your idea, it is more than that. Rather than you feel that you're dipping your toes into innovation, you learn from experts, you benefit from mentoring, and it has positively influenced a number of aspects of my work since. So if you are interested or just even slightly curious, please do seriously consider applying and recommend it to colleagues. You have so very little to lose by preparing an application, and so much to gain, be it as part of the fellowship itself or kind of what then comes after, hopefully. So as you will hear from the other fellows, the healthcare science projects that are being completed are benefiting patients and staff at scale across the NHS, and that's a really great thing to be involved with. So at this stage, I'll pass on to my colleague Jamie, I believe, who is also a fellow in cohort 1, to describe his brilliant work.
Actually, I think we're maybe moving straight to Mark, if we can.
No, we're going to Jane.
Oh, we are going to Jamie. Oh, my apologies, everyone. That's my fault. I think Jamie, is James not on the call?
Yeah, sorry, we're just having some technical difficulties with Jamie, I think. So we'll go straight to Mark, please.
Okay, sorry for the technical difficulties. Mark, are you there?
I am here, yes. Hello.
Wonderful. Over to you.
Lovely. My name is Mark Unstead. Firstly, thanks for the invite again to talk this afternoon. Just as a way of introduction, I'm a respiratory physiologist at the Royal Berks in Reading. Now, I usually speak to a different audience, so I know I'm speaking to scientists. So for those of you who are not sure what that involves, my main job is diagnostic testing of the lungs, usually in an outpatient environment, but a lot of our work crosses into acute care, as well as kind of nowadays community diagnostics and kind of networked care and things like that. So my project was, as part of cohort 2, involved the mathematical modelling of the flow volume loop, which is basically a graphical output obtained from a traditional test that's traditional for us called spirometry, which is our screening test for lung disease. So my project wasn't necessarily a device or an invention, it was just a different way of looking at an established test, and something that was apparent to me that we certainly on the spirometry restart after COVID, certainly experienced practitioners use the flow volume loop graphic as a shape, as pattern recognition to diagnose, as well as numerical data, whereas actually non-specialists or patient or staff that are new to the test, it's sometimes a barrier to diagnosis. So we were interested in looking at the shape of the curve and if we could kind of mathematically model that shape. So the main bulk of the project was building the model itself, and testing against a human panel from my respiratory colleagues in the trust. So to summarise and not to go into too much detail here, so the model performed very well against the panel, and it's still ongoing. So I have academic links with mathematic modelers at our local academic institution, University of Reading up the road, which I wouldn't have had contact with without this fellowship. And it does open doors that were closed perhaps in beforehand, so I'm very grateful for that. And also, using the support of the fellowship, we have presented these findings at our professional body conference nationally, as well as the academic kind of side. So I'm very grateful for that was supported, so we could go to that conference. And personally, from a respiratory scientist, these opportunities don't necessarily come up too often for us. So again, very grateful for the opportunity, and as well as the financial support and just being able to do the project itself. The learning aspects, the modules, which perhaps at the front end look slightly daunting, were really useful looking back on it. And from a point of view of project management, we have great support from Elise Sprosson from the fellowship, as well as medical and scientific advice from Prof. Allen and Dr. Ian Cliff. And certainly I would recommend it to anyone in respiratory and any healthcare professional scientist eligible to have a go at it. I really recommend it. So I'm going to hand you back to, I think, Dr. McCarthy now for the next section in the webinar.
Thank you, Mark. I'm just going to pause in case we can go back to Jamie if the technical issue's been resolved or not. In which case, I'm going to carry on.
Yeah, yes, please do. I don't think we've managed to get him on the chat on the call just yet. But
okay,
thanks.
Thank you. So as you can tell from the photograph, I am not Laura Brown, but I'm delighted that Laura, although unfortunately she can't attend today, has provided us some more insight into her experiences. So Laura and I share the fact that we are both within the clinical engineering specialism. Laura is actually a rehabilitation engineer, and her fellowship project was exploring the use of power assistance for patients using self-propelled wheelchairs as part of their rehabilitation process. And she was particularly interested in actually developing the evidence base in the field of posture and mobility, and particularly getting that evidence to inform clinical decision making, inform the prescription or not of these novel wheelchairs, and aiming to improve outcomes for patients. So in her own words, Laura describes the Innovation Fellowship as having been a fantastic experience, and like Jamie and Darren, who we've heard from, she also would highly recommend it. And the benefit she feels she's gained from it is learning innovation skills, but more than that, developing her network within her local trust and externally, as well as actually applying practical skills that she had learnt into her project, which was focusing on that self-propelled wheelchairs. She was also really grateful for the support and expertise of the D4D team, and in particular her mentor. And of course, it spawned other opportunities. So she's been able to use her protected time also to support a clinical scientist trainee. So this is also benefiting workforce development, as that was aligned with her project. And the projects that she's been involved with have then actually resulted in several national conference presentations. So I'm going to stop there, and I'm going to hand back to Claire, who will give you a little bit more information in terms of timelines of how you apply.
Actually, before we go back to Claire, I think we might have managed to get James on the call. James,
fantastic, great.
If you can you put your camera on and test your sound? Well, this is very frustrating. He can type, but we can't hear or speak to him. That's a real shame, because he's actually on the call ready to talk, but we can't seem to get any sound. James, last try. Are you there? If anyone can remember, James is a bit like a toffee crisp. That's an advert from the Blast from the Past for those younger people on the call. James is on mute.
Vicky, I wonder whether we need Catherine to unmute him like we did for some other people. It might be that. I don't know. Just a suggestion.
No, it's not that.
Okay.
I think he's having a...
Let me just give it one more try. Sorry about this.
Can you hear me?
Yay! Amazing.
Oh, there we go. Thank God for that. Yes, it's our Bolton IT at it again, blocking random things. Apologies.
James, the floor is yours. And we can even see you now as well. Brilliant. Off you go.
Perfect. Thank you very much, everybody. Lovely to meet you all. Everyone here is always a tough act to follow, so I'll do my best to keep things entertaining for a couple of minutes. So I'm Jamie Osborne. I'm a biochemist over at Bolton NHS Foundation Trust, and my project focused on the repurposing of at-home blood collection devices for use in PSA monitoring for patients with living with or beyond prostate cancer. In terms of the fellowship and the benefits it gives, there are loads. I'll try and keep it brief because I think most people have already covered them already, but for me they kind of split into two halves. The first half was for me personally and my skills, learning a lot of things through this program. So if you've not met me before, I'm a bit like a Labrador. I'll get very, very excited, I'll bound into a room and I'll knock everything over and I'll want to do everything all at once, which obviously isn't the most efficient way to run a project. So with the Innovation Fellowship, it was really, really helpful to have that kind of structured approach and say, okay, well, we're going to break it down into different sections. And that really helped organize my way of thinking, and it really helped smooth the project out. So previously, when I've tried to do smaller scale projects, you kind of reach a stopping point where you realize you've forgotten to do half of the things that you've got to do before you can progress to the next stage, whereas that didn't happen because I had the support of the fellowship behind me. And for the project itself, it really, really helped to have the support of the mentors. So if I had questions on how things worked at a larger scale, for example, rather than trying to just do things in the lab, then having their support there was fantastic. It really helped legitimize the project as well. So when I joined the fellowship, I'd only been kind of a year post-training. So nobody really knew who I was. So if you imagine me rocking up, you've never met me before, and I'm going, hey, can you give me all your patients for this project, please? You probably think, well, no, who are you? So having the backing of the fellowship and obviously coming with a little bit of funding always helps. And it meant that we were really quickly able to integrate the project into a much larger system than we originally planned. So my proposal for the original project was to have £15,000 worth of funding, and our target was to do 25 patients via a recruitment clinic and monitor them for a year. Since then, we've managed to integrate into the Greater Manchester Cancer Alliance. I'm now a member of the Greater Manchester Urology Pathway Board and the Trust R&D Board. And off the back of that, we've managed to secure over £100,000 of funding for the project, and our target is now 250 patients. So the project is still ongoing. We're working towards our first full publication from the initial evaluation, but we're looking to roll it on further. And the plan is to take the results of the final end stage of the project, take it to the Integrated Care Board for Greater Manchester and propose it for introduction into routine care. I don't think any of that would have happened if I hadn't done this project through the Healthcare Science Innovation Fellowship. And then, much like Darren, it felt like a natural progression to go on to the Clinical Entrepreneur Programme. So I've been really enjoying that programme. We're coming up towards the end of it now. But again, I couldn't have had the confidence to do that programme had I not done the Innovation Fellowship beforehand. And I think having it focused on healthcare scientists in particular is really, really helpful. Especially for me, when I was an early career healthcare scientist, you look at all the opportunities that are available to clinical staff like doctors and nurses and things, and you think, oh, it's not even worth applying because you know thousands of people are going to be applying. Whereas to have something that's solely focused on healthcare science and takes into account the differences in training that we have compared to doctors and nurses, I think that was really, really beneficial as well. But thank you very much for that. I'm aware I've messed up the agenda with my IT issues, so apologies, I'm not sure who I'm handing over to next, but thank you very much.
Thank you so much for being able to join. We're handing over to Claire now.
Hi, so yeah, I just want to tell you about some key dates. So the fellowship program is being launched today, so you can now submit your applications, and the deadline for these is the 7th of December. And there will be a shortlisting decision given on the 22nd of December. And then interviews will be on the 4th, 5th or 8th of January. And then we are hoping that the programme will start on the 4th of March. And then it will be 12 months from there. Next slide, please. So all the information about this, frequently asked questions and the application form is on the National School Healthcare Science website. So please go and look at that website after this session. And the webinar recording will be on this website as well. And you can download the application, it's a Word document from that website, complete it and then email it back to the england.cso at NHSnet email address with subject line 2023 Healthcare Science subject in the title. About the application form, it's about 6 pages. In there, you'll put in a little bit about your background, and there will be a section in there about your proposal as well. And also at the end, there will be an opportunity for you to put in a statement from your head of department, just so that we know we have your support from your trust to do the fellowship programme. And any inquiries or questions can be directed to me, so my email address is there. And we will be circulating frequently the questions and answers from this webinar as well after the event. And we will have some time now for some questions and answers. So thank you for putting your questions in the chat. So do we want to go ahead now and have a bit of time doing that? Vicky, I don't know if you want to do that.
Thanks very much, Claire. So thanks everyone for listening and to all of our speakers. So we'll go to the questions in the chat. We have had quite a few actually. The first question was, do you need a PhD or medical degree to be considered for this? And actually this opportunity is for those who are working in the healthcare science profession rather than those who are medically qualified. And the second question was, are the fellowships for clinical scientists, biomedical scientists, or both? So it's for healthcare scientists, which is quite a broad discipline, includes clinical scientists, biomedical scientists, but also other healthcare scientists who work in other areas. For example, physiologists, technologists, and I've got a slight lisp when I say it, so I've never realised that before. And any other questions? Bassett, are there any ones that you think we need to particularly focus on?
Yes, there are a few more questions. One is around, I think, is answered to some extent. We are mental health clinicians, like nurses, physiologists, and occupational therapists. Would we be eligible for this program?
So I think those specific groups would be classed as allied health professionals, so wouldn't be eligible. But I see Sarah Bant has put in the chat the slight categorisation of healthcare scientists differ in England and Wales. So if you want to check, please click on those links.
Thank you. There's another question. The next question is answered in the chat. It's around identifying the differences between the HSST program and this program, which is 12 months versus a 5-year program.
Yeah, the HSST is really designed for consultant clinical scientist training or consultant level healthcare scientist training, whereas this is a much shorter program and is focused on developing a specific innovation as opposed to developing scientists to a consultant level.
Thank you. There is another one. Can this fellowship be done within or during the HSST program?
So that's an interesting question. I would probably suggest that someone undertaking a healthcare scientist job and an HSST is probably very, very busy already and wouldn't have the time to commit to undertaking this role in addition, this fellowship in addition. I don't know if Mark or Darren or James as past fellows would like to comment on that, but that's what I would assume. You'd just be too busy to do all 3 things. Yeah, there's nods happening.
Yeah, I agree. I think it would be a stretch.
Yeah, definitely.
Yeah.
Yes, I have a colleague on HSST, and she wouldn't have had time to do this at the same time.
And also, I think within the HSST scheme, you are provided with funding to support your training as well. And so I think, to be fair to other healthcare scientists, it would be nicer to let them apply for this if you are lucky enough to be doing the HSST as well.
Thank you. There's another question. The person is from the Testing Development Laboratory. Is a senior healthcare technical officer, and the question is that I'm interested in fellowship but currently not a BMS. Will this be something can be considered for?
Yeah, so this has come from NHS Blood and Transplant, from the Testing Development Laboratory, a senior healthcare technical officer. So you are a healthcare scientist, so you are eligible to apply. And if you've got a great idea, please do apply. There's also a question, I think, about what can the funding be used to cover? So Claire, do you want to take this?
Yep, I can start, and if Avril, do you want to add to this, you can. So yeah, so you have a bursary, and it will cover your the project materials, and so it's a bursary that you can use for the to conduct the project. It will cover your time. It will cover collaborations with other partners. It will cover attendance at conferences, travel to meetings. So if I missed anything, Avril, did you want to add?
I think we've aimed to be as flexible as we can be. I think that the point is, whatever the expenditure is, it needs to be justifiable and specifically related to the fellowship. So it might be that you want to purchase a software license. If that software license was going to be used across the department, it's for sort of general use, that wouldn't be appropriate. But if it was specifically to support the project within the fellowship, that would be acceptable. We have had some instances where people have used some of that bursary for actually doing some fill-in time for whilst the person is actually doing the one-day protected time. So we're trying to be as inclusive as we can be. So I think my view would be apply, and then we can discuss those issues. If you have queries ahead of applying, please contact Claire, and then we can give you some feedback prior to actually pressing submit.
Thank you, Avril. I think Louise would like to add to that.
Thank you. So I love being able to put a physical hand up. Yeah, just to add, thank you, Avril. From my experience as well with other healthcare science courses where we give a bursary, a really key thing is start talking to your manager. Once if you've been accepted, start talking to your manager to identify where that money has gone in, because it will go into your trust through an education contract. And we have lots of people saying, I don't even know where the money is. So I don't know if anybody's experienced that, but I'd suggest have those conversations as soon as you know that you've been accepted. So there you go.
Thanks,
little
Louise.
tip of the day.
Yeah, good advice there. So going back to the chat, somebody said what inspirational work the fellows have done. That's yeah, we all second that. Thank you for that lovely comment. There is a question on whether you need to have statutory registration as a healthcare professional to do this fellowship, and the answer to that is no, because not all healthcare scientists actually have a requirement to be on the HCPC register. There are voluntary registers and staff who are working towards a registration. So yes, the answer to that is no, you don't have to be. That's it. There's a question here from Ikenna. Do people who have a science degree but have shifted to healthcare jobs, will they be eligible? So I think that would depend on what you're classing as a healthcare job. If it's a healthcare science job in one of the healthcare science disciplines or specialisms listed on the links that are in the chat, then yes, you would be eligible.
There is one question on, can this be undertaken by head of service?
Oh, by head of service? If the head of service is a healthcare scientist and has a brilliant idea, I don't see why not.
There's another question, can junior doctors apply for this as well?
Unfortunately, this is an opportunity for healthcare scientists, so junior doctors would not class as healthcare scientists in the description of a discipline, if you like, because they would come under medicine.
Another question is around if you wanted to develop something and you are a healthcare science, there is often a need for app or web-based solutions. So quite often innovative skills like computer programming. So do you have to have the knowledge of these areas?
So I think that would, Wendy would like to answer this, and Darren actually. So we'll go to Wendy first and then Darren.
Thank you. I think I would say you don't have to have the skills in all aspects of what you want to do, because we can help and introduce you to partners. But if the fundamental core of your project is a computer programming project and you have no expertise in that area, you're going to struggle. But we do encourage partnership working as well. So Darren, you may have some further insights to offer there.
So just as an example, we used part of the funding to support a 8-week matched funded internship program where we took on a student from a local university over the summer who was a Unity ninja, very good at programming, and that was mutually beneficial for the project, but also them.
Thanks, Darren. And I think Mark wants to come in as well. Mark?
Yeah, just to second what you guys have said. The principle in my project was essentially maths, and my school maths teacher would verify that I am not a mathematician. So I was able to get access to the people who could do the maths. I had the idea. I wouldn't necessarily it was a good one, but I had great access to the experts.
Thank you. So if we go back to the questions in the chat, I think there's another one. How would we ensure we can access the funds to backfill the individual for 1 day per week, from Lisa? So this fellowship does not come with salary for backfill. It's expected really that your organisation would be in support of you to undertake the fellowship, because the innovation would be related to the service that you're supporting and the patients and the clinicians that you're supporting with that service. So that would have to be a local discussion, unfortunately. Does anyone want to add to that answer? No? Okay.
There is a question on, do you know how much time commitment so we can inform management?
That's a good question. So are any of the former fellows able to talk about the time commitment that they were required to put in to fulfil the fellowship? James?
Yeah, so I think ostensibly it's supposed to be 1 day of protected time a week. I didn't tend to just do it in one block day. It was kind of just little bits here and there, because a lot of the teaching content is kind of pre-recorded. You can really fit it in around when you want to do different things. So whether it's like an hour each evening, for example, or if you want to spend a whole full day on it, then you can. But that was generally my experience of it.
Thank you. Mark or Darren, do you want to come in?
Just to say, similar to Jamie on that one, roughly a day a week. I had very good support from my department, and had kind of regular meetings with my head of department to kind of keep up to date of how the fellowship was going. Over the course of the fellowship, we gained some further funding, then that freed up a bit more of my time. But I think the fellowship will hopefully benefit your department as well. So you may find there's some ability to kind of flex a little bit.
Thank you. We have another question, which is someone's had a look and there's quite a lot to think about and cover on the form to apply. Do people typically know about the fellowship and prepare before now? So I think the answer to that is no, you just have to crack on. If you've got a good idea, go for it. If in future people would require or would like longer to prepare for applications, that's something that as a programme we can take into consideration. So please let us know what you think the optimal time for preparing an application would be. But please do apply if you do have a good idea. Bassett, are there any other questions in the chat you think we need to address that I've missed?
There is one, I think it looks like incomplete question, but I think the question is that if the clinical research practitioner working within the NHS, can they apply? I think that's the question.
So my understanding is that would be eligible to apply, but we'd have to check on the list of healthcare scientists. So perhaps, again, if you could email Claire and she can confirm that for you before you spend time filling in the application, that would be good. Claire, will you put your email please in the chat so that people can click on that, because I think on the slides it's hard for people to take down sometime.
Yeah, I can do that.
Thank you. I'll just see there's 2 new questions that have just come in. Oh, Wendy's put her hand up. Wendy?
I just wanted to make a general point, if I may, Vicky, because we've talked a lot about the projects, and I just wanted to reinforce that there is also a teaching and training element with this as well. So to just let people know, we have an online platform. So as has been said by one of the fellows, you can access this at your leisure. So there's a lot of pre-recorded talks, etc. That actually came about almost by accident, because originally we were going to do a lot of this face-to-face, and then of course COVID happened, which made it impossible. But we actually found that worked so well in terms of the flexibility that we've kept it anyway. So there is some face-to-face activity, but there's a lot of online teaching and training, and then work that can be done in your own time in terms of things to reflect on. We do recommend that people do, there's about 10 modules I think in all. We recommend that people do the first 4 modules before they start their project, because it just gives them that bit of background in innovation and the sorts of processes that they would expect, which will help them in their projects. So I just wanted to clarify that component of the fellowships as well.
Thanks,
Claire might want to say something else, as I think now.
Yeah, yes, I know it can be a bit daunting to do this application form. It's quite big and there's quite a lot to write in there. And there is something about your proposal, but it doesn't have to be a final proposal. So when you get accepted onto the fellowship programme, there will be opportunity to amend it and also get support and advice from others, and your mentor will also help you to work on your proposal a bit further. So I don't think it's anything that has to be completely final when you submit it. It's just an idea that you have to start with.
Thank you, Claire. I was wondering if Sarah from Wales just wanted to mention anything specific about our colleagues in Wales.
I think not particular to Wales, but something that I just wanted to say was that the really important thing when you're applying is about the need for your area that you're looking to identify a problem for, rather than necessarily the exact solution. So I suppose just going with what colleagues have said, that's the most important thing. So I think it's not necessarily where you've already got something worked up on the side, perfectly described, etc. But it's about actually having that clear need in the patients that you're seeing, or the work that you're doing, or the department that you're working in, and bringing that need back to the NHS as well, and how that's going to really benefit patients, benefit your local population, your service, etc. So I'd say that's kind of the main emphasis really, and hopefully that's helpful for those that are sort of daunted when they open up the forms, but very happy to help with conversations as well.
That's lovely. Thank you so much, Sarah. So we're quite close to the end of the day, so at the end of the call, I should say. So I just want to thank our speakers and all the people who've helped organise the seminar today, the webinar, and also the sponsors of the programme. And I'd especially like to thank all of the people attending, because I appreciate you're all busy professionals and you have patients and services to look after. So thank you so much for spending the time to join us. If you would like to apply, please do. If you'd like to inform colleagues who you think may have a great idea, please do. It's nice to work together to help improve health inequalities and the innovation in the science that we deliver for the NHS. And thanks everyone for your time today. The recording will be available as well for people. So once again, have a great rest of the day, and thanks for your time. Thanks everyone.